Jennifer Roscoe, Jessica Coons, Central Illinois' most accurate forecast with meteorologist Kevin Whitey and Brett Behrens on sports. You're watching WCIA 3 News at 6.
A lot of people say you can't put the genie back in the bottle. Once you've allowed it, you can't go back.
She's talking about telehealth, something that was rather niche prior to the pandemic. A CDC report shows by mid-2020, an average of 30% of weekly healthcare visits happened online.
But as we wrap up 2021, use of telehealth has decreased significantly in Central Illinois. WCIA3's Renee Cooper is here. You've been calling around the hospitals all week. So will telehealth disappear with the pandemic?
Well, some hospitals are unsure how much they'll continue to offer post-pandemic, while others are making it a big part of their future strategy. The goal, to make access to healthcare professionals you need available from the most secluded parts of the state virtually in an instant.
You know, besides the telehealth that's been around for decades with the telephone, which really is, kind of telehealth.
OSF Heart of Mary Medical Center President Jared Rogers says the Urbana Hospital has provided specialized telehealth services for more than 10 years. But before the pandemic, patients were connected to virtual specialists from the hospital, not from home.
That changed with COVID, and you can now get reimbursed for those visits. It certainly supports it to develop much more widely.
Across the board, the pandemic forced facilities to expand telehealth and make it more user-friendly. Decatur Memorial Hospital now offers urgent care and on-demand visits from your phone. St. Mary's Hospital got creative with donated iPads so sick patients could communicate with healthcare staff without contact. In the first few months of the pandemic, Carle Hospital's Director of Public Health, Julie Edwards, says about 60% of Carle's appointments were virtual. Lately, that's down to about 10 to 20%. Interest in telehealth appointments has also decreased at Sarah Bush Lincoln in Mattoon. The hospital covers a rural part of the state. There, outpatient telehealth is available twice a week.
I think there's a little bit something to be desired in a virtual visit versus actually sitting in an office.
But chronic health management requires a lot of travel.
Certainly, and some of the chronic patients that you talk about might have some mobility issues that make it harder to leave their home and get to an appointment. So that definitely is one of the things that we consider with our televisits.
And despite waning interest, Edwards says telehealth is an essential part of the future of medical care. Carle recently got $500,000 in a federal grant to continue expanding rural access through telehealth. Edwards says they're setting up telehealth for the first time in a southeastern section of the state.
Providers are really migrating out of the rural communities and into more urban areas, requiring, in some instances, telemedicine providers are the only providers that they have in certain specialties. So yes, that was happening even before the pandemic, and the pandemic really brought that need and that lack of especially specialty care to the forefront.
Edwards says the ultimate goal is to make every hospital room telehealth enabled. She also reassured that these virtual visits have the highest level of security certification if you're worried about privacy issues. Back to you.
I hope it never goes away. All right, thank you so much. Now, in August, Sarah Bush Lincoln activated its internal disaster plan. The VP of Medical Affairs says it's still in place. It lets patients be held in overflow spaces within the building. He says COVID hospitalizations dropped after a spike that prompted the activation, but they are seeing those numbers rise again. The hospital has taken down the overflow tent outside.
All right, we've got the official Big Ten